Good morning, everyone. My name is Michelle Murphy-Smith, and I'm the Recovery Institute Unit Manager at Via Hope. On behalf of Via Hope, I'd like to welcome you to our webinar this morning, which is Putting Trauma-Informed Care into Action, Promoting Healing and Resilience in Texas. You're likely to have heard more and more lately about trauma and its long-term effects, including on mental health. In fact, last week, a care provider said to me, I want to learn more about trauma because I want to be able to do more than just be empathetic. So we hope to begin a discussion this morning about these issues and some avenues for change. Our presenters today have much to share, so I'll be brief. Leah Harris will begin with a discussion about the ACE study and other evidence, including her own story. She will also share stories about supporting individuals and organizations to be able to provide trauma-informed care. After that, Candace Ayler and Barbara Granger will discuss their experiences and ongoing efforts to provide trauma-informed care across our state. It is our hope that you will hear some inspiring ways that you can work with others to become more than empathetic. And now we'll have Leah Harris's presentation. Take it away, Leah.
So welcome everyone. I'm so pleased that you're joining us today to really talk about how do we put trauma-informed care into practice. I will sort of start out just sharing a little bit about my own personal story and how I came to this work. I am a trauma survivor. I'm very open about that, but I didn't always understand my experiences in that way. I was born to two parents who were both diagnosed with schizophrenia when they were very young. There was a lot. My mom was a single mom, sort of trying to raise me in inner city Milwaukee, and we lived in extreme poverty, and it was a really difficult experience for both of us. I was removed from my mom's custody when I was 5 years old and went to live with my maternal grandmother, who meant well, but was a very abusive woman. And she actually said to me when I was 5 or 6, you came to us as damaged goods. She used that term, damaged goods. And that really sunk into my soul, to my spirit. I felt like I was broken, like there was something wrong with me, that all of my feelings and experiences, my early trauma, had nothing to do with it, but that I was a broken person. It took a lot of years for me to recover from that sense of being damaged goods. I got diagnosed with depression when I was 7 years old. I was first suicidal at age 7. I remember very clearly wanting to die. And it just sort of took me on a journey through mental health systems with a lot of very well-meaning people who did want to help me, but they were not addressing my trauma. So I just collected a whole assortment of different diagnoses, but no one ever really helped me to figure out and make sense of my early experiences, as well as the traumas I experienced in adolescence and into adulthood, frankly. And so I was very lucky that there were some people who made a difference in my life. And, Michelle talked about more than empathy, but, I think empathy is huge. If people can be truly empathetic, that can make such a difference in a person's life. So there were teachers, there were educators who believed in me, who told me that I could heal, that I could recover, that I would go on to achieve my dreams in my life. And as a young person, I couldn't always believe that. I couldn't fully take that in because I was so invested in this idea of being a broken, sick person. But I remembered what they said to me, and they kind of planted these seeds of hope within me. And so I eventually ended up in a terrible group home where I was told I had to be for the rest of my life. But there was this sort of fighting spirit in me that said, no, I'm not going to end up in this group home for the rest of my life. I'm going to achieve my dreams. So I really found the courage to reach out and ask for help, and really found some people who helped me get on a different path. And I'm so grateful for that. I didn't really learn about trauma until years later, after I sort of left that group home. I just kind of tried to muddle through life and fake it till I make it. It didn't always work very well for me. I learned about trauma from the mental health consumer survivor movement, going to conferences, talking to other peers. I started to hear people talking about their trauma. And when I first heard that, it hit me so hard. I remember I just ran into the bathroom and I just started sobbing in a stall because I'd never thought about myself as a sort of trauma survivor, and it was empowering in a way. I heard for the first time, it's not what's wrong with you, it's what happened to you, and that hit me on such a heart level. So I ran into the bathroom crying, and a bunch of other women ran after me and asked me if I was okay. And that meant so much. And that was kind of the power of peer support in the ladies' room. And after that, I just started learning everything I could about trauma and about healing because I think they go hand in hand. And I'm so grateful that really for the past 4 years or so, I've been able to travel around the country and do work locally where I live in Washington, D.C., helping to raise awareness about trauma and its impacts, and how can we, as people and as organizations, become truly trauma informed, and I would add truly healing informed. So, with that little introduction about me, Glenn, if we could maybe go into our first poll, just want to kind of ask a question of all of you. What does trauma mean to you when I say that word? Because it means a lot of things to a lot of different people. So, just no wrong answers, just kind of off the top of your head. When we talk about trauma, how do you understand that? We'll just take a minute or so if you again, just don't overthink it. Just know there's no wrong answers here. Okay, yes, someone says for me it was childhood abuse. Absolutely pain. Yes. A major painful event or change. Absolutely. Absolutely. Anyone else have any thoughts on that? Experiencing something that shatters my worldview. Yes. Yes. Something that is hurtful to the soul. Absolutely. Yeah, these are great answers. Okay, we can just hang up now. You all understand what I'm talking about. Yes, ongoing situation that impacts us over time, negative experiences that impact how we develop or feel about ourselves. Yes, yes. Um, on isolated or ongoing negative experience, hurtful feeling. Yeah, these are fantastic answers. Thank you so much for all of you who shared your thoughts on trauma. So, all right, we can go back to the presentation, Glenn. Thank you so much, everybody. Yeah, really phenomenal answers. So the definition that I'm going to share with you actually comes from the Substance Abuse and Mental Health Services Administration, otherwise known as SAMHSA. And they developed this definition really through a working group of trauma survivors, researchers, practitioners, family members. So they really kind of pulled the field very widely. And this definition is really important because it kind of creates a framework for understanding the complexities of trauma. So they kind of look at it as the 3 E's. And this is, you all touched on this beautifully, so I'm not going to really belabor the point. But just this idea that the first E is an event or a series of events. And it's how it's experienced, that's the second E, how it's experienced by an individual. As people mentioned, as physically, emotionally harmful, life threatening. Someone said it hurts the soul, which is a really profound way of expressing that. And then it has lasting effects on a person's functioning and well being. So I think that's, we kind of throw around that word trauma, like, oh, I was traumatized by the traffic today. Like, no, we're talking about the kind of trauma that really has long-term, lasting effects on someone's life. So this is just another little summary of that. I won't, go over that, but you have that in your PowerPoint if you want to explore it. And the thing that I just want to say about that is that two people could have the same exact experience. And one person could be completely traumatized by that experience, and the other person would sort of, bounce back. It wouldn't have lasting effects on their life. And that has to do with a whole range of factors having to do with resilience and all these other kinds of issues. So I think it's just really important to understand that trauma is a very individual thing. So obviously, there's a very wide range of events that can cause trauma, and some of you mentioned abuse. I think that's what we so often think about, experiencing violence, witnessing violence, loss in the form of neglect or abandonment or the death of a loved one. They can even be caused by trauma, can be caused by events that a person doesn't even remember, such as events that occurred in very early childhood. It can be caused by events that are well intentioned and necessary, kind of such as medical procedures, right? And I think this is something that's really important, and I think is coming much more into our public consciousness, is that trauma can even be caused by an event that didn't happen to a person, but to a group that he or she closely identifies with. So, as an Ashkenazi Eastern European Jewish woman, I come from a legacy and a heritage of fleeing anti-Jewish oppression. My great grandparents were refugees from Eastern Europe and Russia. Obviously, the legacy of the Holocaust, these kinds of things. Of course, we also really understand that the legacy of slavery of African Americans has a similar impact, as well as the genocide of the Native American people. So we can really talk about historical or intergenerational trauma. And then I think the other thing to really talk about is chronic stressors. So we understand more and more that living in poverty, being exposed to racism, all the micro and macro aggressions that result from racism or homophobia or transphobia or any of these other kinds of isms or phobias, um, that they can impact a person over time and actually cause trauma. So, I love this, just to kind of recap what I talked about in the beginning is that we're moving away from this idea of what's wrong with you, what's your diagnosis, we need these diagnoses for billing purposes, but really moving away from that as the primary question to more of what happened to you. And this doesn't even have to be a question that we ask outright, but it's just kind of understanding that the people that we're working with as well as ourselves have very likely experienced an event or events that are traumatic. And also kind of moving away from seeing behaviors as symptoms, to really adaptations to traumatic events. Things I really see now that self harm that got me diagnosed with borderline personality disorder, that self harm was actually my way of trying to cope with overwhelming pain, self injurious behavior. So that can often be seen as a symptom of a disorder, but can we move away from that kind of thinking and understand that these are adaptations? And then the other piece that I think is so critical and so really has so much to do with the work that I believe all of you are doing is that healing happens in relationships. And this is not just some airy fairy kumbaya, let's all heal through relationships. This is really the cutting edge of neuroscience, and that we understand that human beings are hardwired to bond and to connect. So that this is really something that's very grounded, not just in our own experiences, but actually in the emerging science around trauma and healing. So when I talked about the relationships with those teachers that, really saw me as a whole person and not as damaged goods and held the hope for me until I could hold it for myself, I would say that was one of the biggest factors in my eventual healing. So, never underestimate, the impact or the, power that you can have to really help a person shift their lives. So just, some things that I, wanted to mention here is that, the experience of trauma can be affected by lots of different things. When did it happen? Where did it happen? And how often? So I think also if people share their experience and if they are not believed, that can also have a really difficult impact on a person. So I think I just wanted to say that, and that, sometimes systems can unintentionally replicate the dynamics of an earlier trauma and cause re-traumatization. So I know when I was put in seclusion rooms and things like that, it really sort of re-traumatized me. It made me feel like I was helpless and isolated and things of that nature that were very, very damaging to me. And that most individuals who are served in the public system have complex trauma, which comes from experiencing multiple sources of trauma over a lifetime. Um, so, I just wanted to say, reiterate once more. I'm not going to go through all of these because I feel like we've talked about them, but humiliation, betrayal, or silencing may compound the traumatic experience. And I just watched the movie Spotlight. I don't know how many of you have seen that, about uncovering of clergy abuse in Massachusetts, and how it was so liberating for the victims when the newspaper finally, after years and years of cover ups and silencing, kind of brought that story into the public eye, and how the victims, the survivors, just poured in, their calls just poured in saying, yes, this happened to me too, this happened to me too, and how grateful they were that finally someone had given voice to what happened to them. So, I just really want to make it clear, I think we don't want to look at trauma as another sort of pathology, or, something that's a problem within a person. That really, we can look at the effect of trauma, and this is the way that I really like to look at it, as a normal response to an abnormal situation. And that really we're understanding that people have actually done all kinds of inspiring and amazing things to survive, even though maybe those behaviors may have hurt them, later on in life, or turned destructive, but it actually got them through unimaginable pain and difficulty. So, yeah, just to kind of re-emphasize that, trauma has a lot of impacts. It can cause short-term effects over the long term, and the impact may not be immediately recognized. Like, I didn't understand until much later in my life that a lot of the behaviors and things that I was doing to cope, including substance abuse, getting involved in really unhealthy relationships, using food as a drug, that these were ways that I was trying to cope with my trauma. And it can also affect people's ability to engage in relationships. It can have developmental impacts. We look at, children who are traumatized, and how learning it can be very, very difficult for them. And it can have an impact on, all of our relationships, our spirituality, etc. And this is just kind of recapping what I said earlier, that the factors that increase impact is the earlier that trauma happens in life, the bigger an impact that it can have, particularly on a child's developing brain, um, especially when the perpetrator is a trusted caregiver. That can be particularly devastating. Again, when people do share about what's happened to them and they're silenced or not believed or said that didn't happen, a lot of people say that that was even more damaging than the abuse itself. Um, and if there's any kind of blaming or shaming, like I've talked to a lot of people who said, um, it's your fault, you did this. Like, if you didn't dress like that, this wouldn't have happened to you. So all of these kinds of things can really magnify the impact of trauma that people experience. So we're going to sort of shift out of this part to really talking about the adverse childhood experiences study a little bit, because it's really framed in a lot of ways, our current understanding of trauma and how to respond. So Glenn, if you wouldn't mind shifting into a next little poll, a shorter poll. Just, have you heard of the adverse childhood experiences study? How familiar are you with it? Let's see what people are answering. Lots of people very familiar. Oh, wait, now it's evening out. I'll just give it another few seconds or so. All right. So it looks like we have a good mix of, across the board, of not familiar to very familiar. So for those of you who are very familiar, this will be a little bit of review, but just bear with me so we can get everybody caught up. So thank you very much, Glenn. All right. So the ACE study stands for Adverse Childhood Experiences Study. This happened about almost 20 years ago in 1997. And I think it's really important to note that, we've known this information for 20 years, and in many ways it's just now starting to be more widely implemented in social services. So better late than never. But basically what it involved was a collaboration between the Centers for Disease Control and Kaiser Permanente in California. And I don't have time to go into the whole story of how this study came about, but it just briefly, it came about through, it was actually a weight loss clinic that was being run by Dr. Vincent Felitti. And he would notice that primarily women that he was working with would gain or would lose huge amounts of weight only to gain it back and more. And in trying to understand that, he started to learn about the early abuse that women had experienced, and that losing the weight made them feel very vulnerable, and kind of re-triggered their early trauma. So he got the idea to sort of ask these 10 questions about different kinds of adverse childhood experiences. So he asked about abuse, he asked about neglect, and forms of household dysfunction. So if you had a parent who was addicted to drugs or who was not in recovery or from their mental health issues, or was incarcerated, all of these kinds of issues. So it was just a simple yes or no survey. And the findings were pretty amazing. And you can actually, if you're interested in taking the ACE survey yourself, it is at acestudy.org. And so you can actually find out your own ACE score. So what they found is a couple really important things. Is that first, ACEs are very common, that they're more common than we actually understood, and that they result in actually things that happen to us in childhood have continuous serious health consequences for us as adults, or they can. So as I mentioned earlier, health risk behaviors as coping mechanisms, like smoking, eating disorder, self-harm, et cetera, et cetera. It can also have in physical health impacts. So I know I've lived a lot with chronic pain, which is not uncommon, chronic physical pain, which is not uncommon for people who are survivors of trauma. And if people don't get help and support, they can die earlier than the general population. So I'm going to skip this quote, but it really just speaks to how people may use heroin as a way to relieve their childhood pain and cope with their experiences. And this is just really to recap that there's this cascade of effects. That higher someone's ACE score is, the more likely all of these problems can happen. And this is not destiny. This does not mean if your ACE score is high, you're definitely going to experience all these things. But I can say, as someone who has an ACE score of 7 out of 10, I've experienced a lot of the things on this list. And I hope through my process of healing that I can start to reverse some of those long-term effects. So the other thing that the ACE study found was that, as I said, it's extremely common, particularly when we're looking at folks using the public mental health system, that there's an overwhelming number of people who are trauma survivors, and they also have a lot more contact with, we're talking about the adult mental health system. So earlier first admissions, longer hospital stays, they experience more seclusion and restraint, which is re-traumatizing, right? Greater likelihood of suicidality, more severe symptoms. So these are all the kinds of things that people can experience. And then really looking at some of these prevalence statistics, I actually think some of these are low, but looking at substance use, 65% of people reporting abuse, 75% of women, 92% of homeless mothers, a third of veterans seeking help for substance use have PTSD. I could go on and on with the prevalence statistics, but what I just really want to emphasize here is that trauma is not destiny, any more than a mental health diagnosis is destiny. And I love what is said by Dr. Richard Malika, who's a psychiatrist dedicated to working with survivors of torture from around the world, that healing from trauma, like healing from a physical injury, is a natural human process. And I think that is absolutely beautiful. So, in the time I have left, I want to shift into talking about okay, we know the impact of trauma. We know it's having a huge impact on people who are in the public health, mental health system, and people with physical health problems. That we can just assume that the vast majority of people we're working with are survivors of one kind or another, even if they're not identifying that way or they don't see their experiences that way. Given these statistics, we can assume that. So, how do we respond now that we know? So, these again are some guidelines that come from SAMHSA, and I apologize, I'm going to go through these somewhat quickly, but in your resource section that you can download under the file sharing documents, I have referred you to SAMHSA's Concept and Guidance for a Trauma-Informed Approach, which is a document that goes into all of this in a lot more detail than I can do right now, but this is just a capsule summary. So again, we had the 3 E's of trauma, now we have the 4 R's of trauma-informed care. Really understanding that trauma-informed approaches, it's not just about throwing in a trauma treatment. It's a fundamental shift in the culture of an entire organization, right? We are really talking about culture change. And these 4 R's really highlight the basic aspects of culture change that an organization will demonstrate or go through as at the process of becoming trauma informed. And these really reflect it's not enough just to know about trauma. We have to be able to identify it when we see it and how to respond in a way that does not unintentionally re-traumatize people. No one goes into work saying, I'm going to traumatize people today. But we can, accidentally or unintentionally re-traumatize people in services. And that these trauma-informed approaches can be implemented anywhere by anyone. I mean, with the National Center for Trauma-Informed Care, we work with prisons that are working to become trauma-informed, like the Hawaii Women's Prison, Framingham Women's Prison. So if a prison can do it, anyone can do it. And that everyone in the organization has a role to play in moving this trauma-informed culture shift. So these are, basically the 6 principles that I'm going to introduce of trauma-informed approaches that really guide the trauma-informed change process and that can help organizations to figure out, are we on the right track or not? It's really about a values-based way of working with people that is really about how do we create environments that heal. So you can have all the best and cutting edge trauma treatments in the world at your agency or your organization, but if the overall environment itself is not trauma informed, that's all going to be less effective. This is not a checklist. This is not a do X, Y, and Z and you'll be trauma informed, because every organization, every agency is different. But these are just some guidelines that to be considered. And I'm going to go over these very quickly, unfortunately, but you'll get at least a taste and a flavor. So these are the 6 key principles of a trauma-informed approach, and these were, again, just like the definition of trauma. This was developed in consultation with a broad number of trauma survivors themselves, mental health providers, family members, a whole range of stakeholders. And so they sort of drilled it down to these 6 principles, which I'm going to sort of go into in a little bit of detail. So safety. Safety is, I don't think it's first by accident. It's a tremendously important principle because the experience of trauma so often is like a threat to one's fundamental well-being or sense of survival. And when people are in the trauma response, they are almost back in that original experience, right? Our body and our minds are reliving, what happened in the past again in the present. So how can we establish a sense of safety in our organization? And yes, it's about the people receiving services feeling safe, but this is a holistic approach. So it's the people receiving services, the people providing services. It's that everyone feels safe physically and psychologically. And it's a complicated issue. Not everyone defines safety in the same way, right? For those of us who have to deal with things like risk management. It's for providers, they're needing to maximize control over the service environment, right, to make sure everyone's safe. Whereas for providers or for people who use services who've experienced such a loss of power and control in their lives, they often define safety as having control over their own lives versus the environment. Do you see the difference there? Um, so it's, I think it's tough when you have these sort of conflicting definitions, but I think they can be bridged, and I think that through trauma informed approaches, agencies and organizations can promote a safe environment where everyone is feeling safe. So I'm not going to be able to go into these questions with you all, but I encourage you to reflect on these after this webinar. If you work with a team, these are all questions for discussion that you can work on together. So the second principle is trustworthiness and transparency. I remember I was in a residential treatment center as a young woman, and I did not want to be there. I didn't find it to be a very healing environment. There was a lot of seclusion and restraint going on. It was a scary place, and I remember talking to my psychiatrist and saying, when can I get out of here? And he said, well, that's up to you. And I was like, great. Well, if it's up to me, then I'm ready to go. Like, let's get the discharge going. And he's like, oh, that's not exactly what I meant. It's not exactly up to you. That's an example of not being trustworthy, not being transparent, right? He could have said, I don't know when you're going to get out of here. We don't have a date set, but like, let's talk about, what we can do together to help you to get out of here if that's your desire. Like, do you feel the difference in that kind of response versus, oh, that's up to you, which is so kind of, disingenuous, right? So I think one of the most powerful ways of building trust is to give people full and accurate information. I think sometimes it can feel so disempowering when we don't know what's going to happen to us. We don't know what the next step is. Being authentic, and letting people know, the limits to confidentiality. If you're required to break confidentiality when someone talks about wanting to hurt themselves, for example, or wanting to hurt someone else, it's better to tell them up front rather than to assure them of confidentiality, right? And then break trust. So that's really critical. And sharing our own reactions and responses in a truthful manner. That's what being authentic is about. Trauma survivors have and I think this is very true in my own life, this finely tuned radar to detect other people's emotional states. We had to develop this capacity as a form of vigilance, right, to protect ourselves. And if you as a peer or as another clinical provider are untruthful about your feelings, even if you were trying to protect the other person, they're likely to detect it, right? And trust can go out the window. And again, these are some questions that you can really reflect on in the coming weeks and months at your organization about how can we promote trust? Do the people being served trust the staff, and how do we know? And how can we address these trust concerns? So the next principle that I'm going to talk about is peer support, which is one that is very near and dear to my heart. Peer support really, really helped me personally in a lot of ways, and I've seen the power of it in the lives of so many people. And in this webinar, I'm really talking about peer support across the lifespan. I mostly work with adults, but youth peer support is a really growing field. Family to family peer support. It's really, we're defining peer very broadly here, as in people who walk in similar shoes, people who have their own lived experiences that they can share with one another. Um, so this is just a definition of peer support that comes from intentional peer support, which is a training by Sherry Mead. I don't know if you all have, anyone's received IPS training in Texas, but it is a wonderful, wonderful, intensive 5-day training that I highly recommend. And it's really based on these principles of mutual healing relationships among people. We don't act in a top-down kind of way. We don't use clinical language or focus on what's wrong with people or anything like that. The heart of peer support really involves building trust. I think that's what's so critical. The first job that I ever applied for in the mental health field was at a transitional housing facility. And it was really weird because they said, well, we're hiring you as a peer support specialist, but really the title should have been like peer spy or peer mole. Because as they described my job to me, they said, well, first of all, you need to make sure that the residents are not like cheeking their meds or like that they're really taking their meds. And second, if you hear them saying anything that we the staff should know, then you need to like report back to us. So I was like supposed to be some kind of a double agent. That's not peer support. If people feel that peers are acting as proxies or reporting on people's behaviors, that really damages trust. And I want to say that peer support is not just important for people who are using services. I think I always emphasize this, that it's really important for staff who are trauma survivors to have access to peer support. And, I see so much in the mental health field burnout, compassion fatigue. People are living with their own trauma. Even if they haven't had trauma in their childhood, they've likely, just being in mental health, we witness a lot of trauma in the lives of people we work with. We may lose people to suicide or to violence or to overdoses. These are realities that people, experience every day providing services. So I think it's something that's important for everybody. And so again, these are just some discussion questions that you can use to kind of take this conversation further, after this webinar with your team, with anybody that you're working with. And I know that Via Hope is a peer-run agency that works with a lot of other agencies trying to improve their or enhance their peer support services. So the next principle is collaboration and mutuality. Um, I think that this is really, really important because trauma at its heart is the so often sometimes it's just things like natural disasters and traumas that just emerge in nature. But so often it is the abuse of power by one person over another, right? So people are literally disempowered. Sometimes they feel they're without power. Um, and so there's all these power dynamics in our mental health systems, right? And we so rarely talk about them. So trauma informed care is really about let's acknowledge them, let's talk about them. We may not be able to fully level the power hierarchy, but how can we really work on moving in that direction? So, leveling the power hierarchy between staff and clients, among staff, from the direct care staff to the administrators, recognizing that everyone has a role to play and that it's about meaningful power sharing and sharing decision making. Really maximizing the collaboration and including peers and families and consumers in all of the decision making processes. And I just love, this phrase that we use a lot in our trainings, which is one does not have to be a therapist to be therapeutic. So, how can we really build much more of a culture of collaboration, of sharing power, of empowerment in our organizations and in our agencies? So, yeah, I mean, I think that there's lots of different kinds of examples of collaboration. I think the most obvious one is involving people with lived experience, involving families in committees and decision making processes. Really promoting self directed recovery where we're not telling people what to do, but we're facilitating people figuring out what they need for themselves. Abolishing segregated spaces like staff only bathrooms with, service user bathrooms, things of that nature that kind of send a message, right? Um, and so, I think these are just some really brief examples of how we can increase collaboration and mutuality. And I'm sure you can think of many more. And here's some questions that, again, you can use for further discussion as to how can we examine how does power operate in our agency? How can we level some of that? How can we promote real partnership between the staff and the people receiving services? And really move towards that level of collaboration and mutuality. So empowerment, voice, and choice, again, for for survivors, these are so huge. A lot of the services that I experienced, like we didn't have a choice in so much of what we did. It's like we're doing this now. Next, you're going on to this. It was like everything was mapped out and scheduled, and there was no sense of empowerment, voice, and choice. I couldn't say I don't want to go to that group. I don't want to do that. I want to do something else. Like there weren't those kinds of options so often for me. Um, and what I love about this is that, it's really about having a deep belief in resilience and healing that drives, that's the empowerment piece that really drives organizational culture. That we believe people can heal, we believe people can recover. That underlies everything that we do. And we are really about helping people to develop their own self advocacy skills and to feel empowered. I think that that is a huge, huge step for so many people who've been told all their lives what to do, how to do it. They weren't capable of making their own decisions, right? I'm sure many of you have heard the term learned helplessness. I actually say that it's taught helplessness. That these are things that people are taught to be helpless and to see themselves in a helpless role. And how can we shift that, right? So, here's examples, really kind of turning problems into strengths. I'll just give you a quick story. In one hospital that we worked at, there was a woman who was injuring herself a lot when she was under stress, and she was actually offered the task of being the hospital safety officer. So when she started to want to hurt herself, she was encouraged to make the rounds and identify all the possible ways that she could do it, all of the items that she could use to hurt herself, and let the staff know. She often tracked down dangerous items that in the environment that no one else had even noticed. So that's an example of turning problems into strengths. Um, I think it's really about a creative attitude rather than a specific technique. I think there's also really concrete and beautiful things that can be done, like painting murals together, which beautifies the environment and something that everyone can be proud of. And again, some discussion questions that you can use. And then this last principle on, cultural, historical, and gender issues. I mean, I could spend such a long time talking about just this alone. It's so critical, because our culture, in terms of our identity, um, the groups that we identify with, where we feel we belong or don't belong. Also, gender. There's so many deep and important issues about gender and the history that we come from. My mother, being of Jewish heritage, when she would experience psychosis, it was so often about the Nazis. Her that was the content of her, delusions or her visions or her hallucinations, and nobody ever talked to her about it in a cultural context. Like, what does this mean to you as a Jewish woman? Why are you having these visions of Nazis? It was just like, oh, there she is, schizophrenic, psychotic again, so really understanding the role um, of culture. And there's so much I could talk about with this, but I think it's really about not making assumptions about people, asking people how they'd like to be addressed, gender wise, um, asking questions, being curious. I think that is really the biggest piece. Is if we make no assumptions, and just address every conversation as a cross cultural conversation, because people are telling us about who they are and what it means to them and their history and their culture and how that's impacted their experience of trauma, and it could point clues as to how people might begin to heal. So, Glenn, do we have time for the last poll? All right, this is a quick poll, and I made this intentionally tough for you guys. But if you had to choose one, which of these principles do you think is the most important? There's no right or wrong answer here. So we're seeing a lot of there's a tie between empowerment, voice and choice, and trustworthiness and transparency. Safety is a close second. Oh, looks like empowerment, voice, and choice is starting to win. Then we have peer support is one of the contenders. But yeah, it looks like uh, empowerment, voice, and choice is the winner. And again, this is just kind of to get you thinking about the values and the principles. There's no right answer here, and they're all interconnected, right? So thank you very much, Glenn. Um, so yeah, peer support is like a way to foster trust, is a way to promote transparency. It's a way to promote empowerment, voice, and choice. For example, so these are all interconnected. But it was just a little question that I like to ask in my training to check and see where you're at with that. So the last thing I'm going to talk about, I just have a few more minutes. I want to make sure to give Barbara and Candace time. The implementation piece, and I'm not going to be able to go into everything about this, but training alone is not enough. People understand these trauma-informed principles, but how do you do this in practice? So I've been part of virtual learning networks where organizations are working together to do this. And this, I'm not sure if this is happening in Texas. I'd love to hear more, but this is really something that you as a state can think about, starting your own virtual learning network around trauma-informed implementation if it doesn't already exist. And I've provided several examples here of agencies we've worked with. I'm just going to talk about one in the interest of time, which is Seattle Counseling Services. And you can look them up. They're the oldest LGBT serving organization, actually in the US and in the world. They were established in 1969. And they really revamped everything they do. They came up with their own organizational values. They're around trauma informed care and empowerment, all the things we've talked about, and they incorporate these into their hiring process, into their orientation process, into their supervision process. They really worked hard on the physical environment, and they see themselves as a social justice focused agency. So they participate in gay pride events. They open their space to LGBT social justice organizations to meet. So they're really, really trying to live as a values-based agency and foster a trauma-informed approach and a healing-informed approach. And this is another one that I encourage you to look at is the Core Center in Chicago, and the real difference they've seen in their organizational culture as a result of incorporating peer support. So I just wanted to sum up. I think it really all comes down to empathy is more important than we think, just as I started with. Sure, we want to go beyond that. But this quote by Maya Angelou, that, I've learned that people will forget what you said, people will forget what you did, but they will never forget how you made them feel. And I can say in my own life that is so true. I just remember people who reflected my capacity to heal back to me. They had more effect on me than anything else, any intervention. It was really just about how that person was with me in relationship. Pay that forward in my life today, and I hope that all of you will as well. So I'm going to transition over now to Barbara and Candace. Thank you so much. Really appreciate it.
Thanks so much, Leah. And we're definitely glad to be here today talking about this important topic and the perspective of what we're doing in Texas. First, I'd like to introduce myself. My name is Candace Ayler. I'm a children's mental health advocate in Texas and consultant on trauma-informed system transformation and parent and family engagement, partnership, and leadership.
And I'm Barbara Granger. I'm the family coordinator here at Via Hope, and I'm also a family representative on the Texas Children Recovering from Trauma initiative here in Texas. So we're really glad to be here.
So I think part of the reason that they chose us to talk about this topic is our experience as a parent in Texas. And a family member. I've had my own experience trying to find help for a family member that had traumatic experiences in the mental health system, in the school system, and really our journey began almost 14 years ago when PTSD barely even considered a condition in the DSM for kids. So when I did try to tell people, and I also happen to be a nurse, and so I did research. I tried to figure out what was going on with our family member to get them the right help, and it seemed like PTSD, and I kept trying to tell school staff, I think this is some kind of PTSD for kids, and I remember them saying, no, that doesn't happen to kids. They bounce back. Well, now we know that they can bounce back, but they need the right kind of help.
Well, and my experience with trauma really is a little more subtle than Candace's. We adopted a daughter and really just saw some signs, but really didn't understand a lot of what was going on. And so it was always symptomatic to something else. And I remember when she was 9 and acting out and being very physical with me, that the psychologist actually said, gee, if I didn't know better, I would think she has like an attachment disorder or something. And he was thinking that now she has this very stable life. And, as we began to really understand what trauma was and how it affects children very, very early in age, we really started to understand the impact that the trauma that she experienced very early in her life, the very first pre-stages, and then her first months of her life has affected her throughout her childhood, and then even carried on through the adults into her early adulthood. And so, it has really helped me to understand that there's a lot of subtleties to trauma, and sometimes people really attach a diagnosis or a symptom to that when it really is, from a traumatic event, and helped me to really understand how to react and respond to her a little more appropriately, and then to help families to understand some of those subtleties that may have happened in their life and can attribute that to trauma instead of something else. So, hold on, we're experiencing some technical difficulties here. So, with our lived experiences, we have navigated systems in Texas and are helping families and children really to seek recovery from traumatic experiences. So that's kind of our mission. And the more we work in it, the more passionate we become. So one of the things that Leah was saying was that she was wondering if things were happening in Texas, and yes, they are happening in Texas, and we're very excited about this. Last summer, a trauma-informed care initiative was expanded through the Department of State Health Services, and 16 different pilot sites across the state of Texas joined together to really explore how they could really begin the transformation. And so it was what they called it Trauma-Informed Care Organizational Transformation Learning Collaborative. So there are, like I said, there are 16 pilot sites. 7 of them are local mental health authorities with 9 substance abuse treatment providers, and also 9 substance abuse prevention providers. Some of those work, on those together, and then some are separate entities. We also have 1 tribal nation in El Paso, and all of this covers 86 counties, with 3 of them being NCTSN members, which is the National Child Traumatic Stress Network.
So the Learning Collaborative was a part of a longer project that's been going on since 2012 in Texas. And Barbara and I both are parent representatives. on the Texas Children Recovering from Trauma Initiative. This is an initiative funded by the National Child Traumatic Stress Network, and the grant is with the Department of State Health Services to transform all of the local mental health authorities in the state is the ultimate goal, to become trauma informed. So whereas the goal of the Learning Collaborative was to transform the mental health services across the lifespan, our initial goal was focused on children. So some of our resources are going to be more specific to children's mental health, and being a collaborative with, or a program with the National Child Traumatic Stress Network. We also have some resources at the end of this presentation that Leah offered and that she referenced in her presentation quite a bit, that are specific to adults as well. But the initiative with Texas Children Recovering from Trauma was focused on ages 3 to 17, and this original pilot site was with the Heart of Texas Local Mental Health Authority. I'm not sure what their new name is. I think they're still the MHMR Center. Right. And their initiative locally is bouncing forward. So with the membership with the National Child Traumatic Stress Network, we were able to have access to a wealth of information and resources. Now, I have posted the website on the top of that slide there, and if you download these slides, there will be links at the end of the presentation that you can download that will be clickable, so you don't have to write all this down as I go through. But I will tell you that first link is to a website that has a lot of very robust information, and it's kind of hard to navigate. So we wanted to give you a few of those resources, so you could leave today with those resources. And I'm sorry, I'll go back real quick. I'm not going to go over each of these, but there are, for every system that your child may encounter, or that a person may encounter to seek services and help recovering from a traumatic event or traumatic experiences, there's a resource for almost every single one of those. And here, talked about the trauma-informed systems. There's also child welfare, education, juvenile justice. There's a resource for treatments that work. There wasn't really a handout, so I'm not going to talk about that, but there'll be a link to it at the end of the presentation. And then there's a wonderful resource on the site for parents and caregivers. So the Child Welfare Trauma Training Toolkit is available through the National Child Traumatic Stress Network, and all of their resources are free, which is also nice. The National Child Traumatic Stress Network, also members of the network, partnered with the Department of State Health Services and have provided quite an extensive amount of training, including this toolkit. Parts of this toolkit have been trained across the state. Then the toolkit for educators, I personally have used. I've taken this to schools to try to help educators understand the behaviors that they seem to think were just defiance or just acting out. A lot of times those behaviors have to do with an actual event that child's experienced, and to help them put that into words that educators can connect to, and trying to find ways to even build that language into the IEPs. So individual education plans. So the NCTSN's site, their website for educators, you'll see the graphic on that slide has a schoolhouse, and there's actually a large amount of resources. And if you send just that link, and it'll be at the end again, to an educator, an administrator, they can actually find quite a few resources that they're looking for on that site. So it's a wonderful site. And then with juvenile justice, there's bench cards that were developed by judges. There's a very large group in the network it's called the Justice Consortium, and there are judges, there are prosecutors, attorneys, and then mental health providers and families all members of this consortium, and one of the wonderful products that they developed was this bench cards for judges. So this basically gives, you can give this to judges if you're trying to work with your court system locally, to give them an idea of what they might be able to use to apply to their actual practice in the court. And then this resource, I just kind of gave you a screenshot of the page. This is probably another one of the more robust pages on the NCTSN site. And you'll see there's tabs at the top of that page. When you do go to the link that's at the end of this presentation, there's tabs for understanding trauma, and gives you lots of resources on how to the things that'll help you begin to understand how trauma may be affecting a child. There's also the next tab is ways that parents can help, and it gives parents very concrete resources for how they can help, and then understanding some different trauma treatments. And then the Learning Center is where a lot of the training for people that are wanting to work with children or work with children who've experienced trauma. This is where the meat of the training is. It's a different site. It's the NCTSN, but it starts with the word learn, and again, it's at the end of the presentation. But on this site is psychological first aid training, very similar to mental health first aid. Well, actually not similar. The mental health first aid training is more about identifying conditions and being able to identify certain behaviors as conditions, I believe. I haven't taken it, so don't quote me. But the psychological first aid is more about being able to understand how to respond and how to respond in a crisis. There's also a resource parent curriculum on that site. And then the Child Welfare Trauma Training Toolkit that I mentioned before is also all on that site. It's free to log in. You do have to log in, but it's free to do that, and then you have access to everything on that site.
So we wanted to really give you an idea of some of the learning communities, consortiums that are really focusing on trauma. If you're in that area, and even if you're not, you can join a lot of these efforts and gain more insight into it. So the first one that we want to really look at is the Trauma-Informed Care Consortium of Central Texas. And we included the website for you to be able to go there and even join and get their newsletter. They have a local resource directory, so if you're in the Central Texas area, which is a fairly large area, you're able to look at the resources there. They also offer trainings, and they have a community survey to keep their information updated, and then they have quarterly meetings, so you can actually join them in person and at their meetings for discussions. They also have different events. Tomorrow they're having a Paper Tiger showing, which is an awesome documentary. It is sold out, so bummer for the ones of you that haven't been able to see that, but I really encourage you, if you have not seen that, to look for an opportunity to see that. And they actually have come out with a sequel that has not been shown in Texas yet, so look for that. It was Robert Redford's son.
Robert Redford's son, James Redford, is the director of both of them. And the new follow-up to Paper Tigers is called Resilience. So if anybody would like to host a showing, I would very much like to be able to attend. I haven't been able to see it yet, so I'm very excited to see Resilience.
So the Consortium of Central Texas also has a biennial conference. It was last year, so look forward to it in 2017. It was excellent last year, so put that on your calendars as soon as the date comes out. So the other one that we really want to highlight is the Mental Health Connection of Tarrant County. It has a website, Recognize Trauma. It also has a local resource directory and has an annual trauma conference. They just had theirs in February. They always bring in really very well-known speakers, and they have breakout sessions. So it's a really robust, I think, full day. I'm not sure if it's a 2-day, but it's very robust and full. So I encourage you to look for opportunities to join in any of those efforts. Also, DePelchin Children's Center, which is I think their headquarters is in Houston, but they have several sites across the state. They focus, they have an annual trauma conference, and it was last August, so I'm anticipating that it would be sometime in late summer that they will have another trauma conference. And so, DePelchin also offers like clinical services and professional training. DePelchin is an NCTSN affiliate, and so is Allevion in El Paso, Allevion Inc. in El Paso. So those are two NCTSN affiliates besides the Department of State Health Services here in Texas. So there's another initiative that has been really focuses on mental health and and IDD, which is intellectual and developmental disabilities. There's a project Janus that's out of San Angelo, and it has a brochure, a little booklet that I find very useful to hand to different providers to understand how to respond appropriately to this population. There is, and then also the Hogg Foundation here out of Austin at UT has developed, along with the NCTSN, a trauma and IDD toolkit that is for providers. So it is very robust and has a lot of information. And even as a family member myself, I was able to go on and look at it and gain a lot of information from it. So I think as informed family members, you can take some of that information and implement it and use it for yourself, even though it's for providers. So wanted to give you a couple of upcoming symposiums that are happening this summer. The first one that we want to highlight is here in Austin at the Crown Plaza, and it is 2 days. It's June 9th and 10th. The first day is on building bridges for youth, and Beth Caldwell will be featured. She's with the Building Bridges Initiative, which really works with residential treatment centers and helping them to be more trauma informed in their implementation of all of their policies and procedures. And this day is going to link families and communities, mental health providers, and system leaders to support more effective collaboratives. It'll focus on trauma-informed care with family and youth engagement. Day 2 is creating stronger organizations for everyone. So it will really have time for you as an organization. If you want to bring a couple of your key administrative staff, that would be awesome. You're going to really look at how to build more responsive trauma-informed care within your organization for adults or youth. And it will focus on those 6 core strategies that Leah just presented earlier in the presentation, and will really focus on building those out within your community. So it will also have best practices with the intellectual developmental disability, and really focus on helping your staff flourish to be more trauma informed.
So that event is sponsored by the organizations that you see listed at the bottom there. There's collaboration with Hogg Foundation, the Texas Institute for Excellence in Mental Health, the Texas Network of Youth Services and Texas System of Care, and the Department of State Health Services and Department of Family Protective Services. And then in addition to that event, there's also going to be a statewide symposium on trauma associated directly with the work that I mentioned earlier with the NCTSN grant that DISHES has. And so we'll be in collaboration with the National Child Traumatic Stress Network, and again our partners with Texas Institute for Excellence in Mental Health and Texas System of Care. And the details of that conference are haven't been ironed out. I can tell you that it will be open to the public, and it'll be August 17th and 18th. And then we just wanted to give you a heads up in case you're wanting to go ahead and continue with some great content on trauma for the rest of your week. There's another webinar tomorrow at 1 p.m. Central Time, and it's with the National Council on Behavioral Health, and it's Becoming Trauma Informed. What does this mean for non-clinical staff? I'm kind of excited about that because I'm assuming that'll be including our peer staff, like as family peers we are. Right. So, as promised, we have links to resources here at the end of the slide, and I did just want to go through these briefly so you can kind of see what they are. This first slide was some resources from Leah. And that middle document is actually, there's a good discussion in that document from SAMHSA on the 3 E's that Leah mentioned, which is also my personal favorite definition of trauma, and the 4 R's of transformation.
And the first one, engaging women in trauma-informed peer support, Leah was explaining to us that it really goes beyond gender specific. So I think there's a lot of robust information in there that can be gained for all of us.
And I saw Leah posted in the chat that the Engaging Women Guide has a lot that is good for all genders. I remember she mentioned that when we were talking. And then, did you talk about the ACEs Too High one?
No, I think the ACEs Too High will really give you some information on, I noticed in the chat box that there were some that were really interested in resiliency, and so I think this would really help to answer some of those questions.
So the rest of these are the resources that I mentioned through the National Child Traumatic Stress Network, the Trauma-Informed Systems. On the last slide was also the child welfare, and I just want to, I'll go back to that real quick. Where it says child welfare, that's actually a link to the page on the site regarding child welfare, and then underneath that are some additional links to specific resources. So if you go through this presentation resources, the education page, and then the actual toolkits, the juvenile justice page, and then the actual bench cards, and then the treatments that work page. Also the page I mentioned for parents and caregivers. There's also a separate page on the network's website specific to partnership with families and your organizational transformation efforts. And the final document I'm definitely proud of because I helped develop, but it's on sharing power, and Leah mentioned that in her presentation as well. In our efforts to transform organizations to understand that shift of really thinking about what's happened to someone instead of asking the question what's wrong with them, we really there's a transformation in that process where providers and even administrators and people that become trauma informed begin to understand that what they're doing is shifting power to allow a more balance of power and relationships even in their daily life. As I was going through this process of understanding trauma, I began to reflect this on myself and began to understand that if I expected the clinical staff and staff in facilities and schools, and if I expected them to change the way they were thinking and approaching my family member, I had to change my approach. I had to reflect this information even onto myself and be willing to think about the things that had happened to me and my own historical trauma and relate that to how I was reacting and change my responses to be trauma-informed myself. So I'm definitely proud of that document. I noticed there were some questions about the paper tigers documentary. Sorry. And I just wanted to give a little bit of information about that. If you've heard of restorative justice, it's a model of transforming the way we approach discipline and approach behaviors in the school system. And Paper Tigers is a story, it's a documentary about a school that did that and completely transformed their entire school in Walla Walla, Washington. And the way that changed everybody involved, the teachers and the students, and had a profound impact on all of them and their relationships.
So as you can see, there is really a lot going on in Texas surrounding the topic of trauma-informed care, and there will be continued expansion for this topic. I know Via Hope is going to look into expanding from this webinar to looking into some of the maybe specifics that we're all learning about practical applications. I know that there's time for question and answer. So if you have a question and you would like to put that in the chat box, feel free to do that, and then we can try to answer those for you.
I saw a question in the chat box about resiliency reads. There's a workbook by Nan Henderson. I can't remember the name of it, but it talks about resiliency. But it has some wonderful activities in the workbook to kind of understand how to find your own personal path to resiliency. I like that one a lot. And it also, I like the way that she frames understanding protective factors and how we have to be able to identify, like, you know, I remember growing up, there were these stories of strength. My great grandmother was one of the only infants that survived the 1900 hurricane. And that's this, you know, amazing story of strength. But you know, when I think about it through a different lens, that was a really traumatic experience that she went through as an infant, probably affected her development, which would have affected her parenting. But we always viewed this was a strength. So there were strengths in it, and I have to continue to honor those, as well as understanding, you know, how it affected probably our whole families for, you know, generations development. So.
There was a question in the chat box about different books, and Leah has put in several additional books that people can look into to explore more trauma-informed care and understanding about trauma and how it affects a person.
Okay, yeah, I just wanted to read those for those who might not have access to the chat box in the archive. So yeah, Donna Jackson Nakazawa, who herself is a survivor of complex trauma, wrote a great recent book called Childhood Disrupted. If you Google her name, you know, she's done podcasts and interviews. You know, you can do a lot of exploring of her work. I am a huge fan of Bessel van der Kolk, who is a psychiatrist who works a lot with survivors. And his new book, The Body Keeps the Score, I think is one of the best books ever. It's actually very accessible if you're not a psychiatrist. But he talks about all the resilience building methods that he's discovered, whether it's yoga, mindfulness. He's really big into theater and creative arts, which I'm also a huge fan of. So kind of talks about how those have been helpful. Um, I know yoga is not for everybody, but there's, more and more understanding of how trauma sensitive yoga can really help people to kind of integrate those experiences on a mind body level. So those are just some that I can think of. And, there are also survivor narratives out there that I'm just blanking on at the moment, but those are a really good start. A documentary that obviously Paper Tigers was mentioned. Another one that I found was very powerful was something called Wounded Places, which is available online for free, I believe. It's a 45-minute documentary talking about the trauma of living in inner city Philadelphia and some efforts that the city is taking to, really focus on those, aspects of how do we heal on a community level. And then there's another book that I forgot to mention, Peter Levine, Waking the Tiger, which really talks a lot about somatic experiencing. And really just the idea is that trauma lives in the body, even if something happened 20, 30 years ago, it can still be stuck and live in our body. So what are different techniques that we can use to release that trauma from our bodies? And those are endless. I mean, there's so many different modalities that are out there now. And I think it's just about, exploring what works for you, because not any one thing is going to work for everybody. But yeah, I can't think of anything specifically on mindfulness that is geared particularly towards trauma survivors, but I know Bessel van der Kolk talks a lot about that in his book. The documentary, someone asked me to repeat the last two. The documentary I mentioned is Wounded Places. And if you just Google Wounded Places documentary, it's free online. It's 45 minutes. And then Waking the Tiger by Peter Levine. And he's, done, again, if you Google Peter Levine, Levine, and trauma, you'll find so much, kind of interviews and articles by him. Another person I would really encourage you all to discover is Dr. Gabor Mate. He has done absolutely phenomenal work around these issues, particularly on trauma and addiction. And if you go to his website, he has a ton of articles about trauma and addiction and the healing process and what he's seen that has helped people. So those are some of the ones I can think of right off the top of my head. There's also just a lot of podcasts. There's the Trauma Therapist podcast that just every week has an interview with a different trauma therapist. So that's a really good free resource. And I would highly recommend Healing Neen. Yeah, and that is also available online for free. Healing Neen, Neen. Yeah, that is, thank you for that, Angie.
We're switching back and forth from the microphones, but I just want to thank you all for being here, and we look forward to, thank you, Leah, for being with us today and sharing all of your knowledge with us on trauma and what the effects that it has. And then just thank you all for being here on the webinar, and it should be on our website. I guess look for it soon. So thank you, and we will say goodbye.
Thank you.